Hi there, Peter Beckinsale here. Thanks for watching this clip on ICL or intraocular Collamer lens surgery. You can see the lenses are very thin and supple, approximately 100 microns or 1/10 of a millimeter in the center for a short-sighted correction. Loading the lenses ready for injection is a critical part of the surgery. If they're loaded correctly, everything else will go a lot easier. Drawn into the tip of the cartridge. 1 millimeter incisions at 12 and 6 o'clock. I like to angle them slightly. I find it gives better access for later parts of the surgery. Fill the chamber with OcuCoat, leaving visible chains to be sure we're not overfilled. 3 millimeter temporal clear corneal incision, being extra careful not to touch the lens, of course. And then here's the ICL in its injector system. I like to unfold fairly slowly. Some people seem to pop them in quite quickly, but I like the reassurance that the positioning is correct and nothing's going to be touched or damaged on the way in. You can see the little circles there are the alignment marks. Also some small lines showing that this is a toric correcting lens or astigmatism correcting. This is the tucker used to tuck the haptics underneath the iris. I find we can usually get both distal haptics from the one access point without touching the optic. The proximal haptics can be tucked through the main incision. One has to be very careful, of course, not to place too much downward pressure, or there's a risk of marking the crystalline natural lens. A suture is sometimes required, just depending a little bit on how the wound is looking. I like to use an irrigation aspiration system to remove the viscoelastic material from inside the eye. I can be sure I get thorough removal of the viscoelastic. And this is the Zeiss Callisto system showing correct alignment of the lens. Here's another case to show they're not always straightforward. This one started off looking absolutely fine. Alignment marks all fine. And the lens slowly coming in, beginning to unfold as it should. But then the unfolding just doesn't want to follow through, and part of the ICL lens is staying tucked up on itself. If the lens is badly folded, or worse still goes in upside down, it can be removed, reloaded and replaced, usually without too much trouble. In this case, I was able to gently position that haptic to unfold the lens without touching the natural crystalline lens, and straightforward from there. Thanks very much for watching.